Hi, today I'm going to be discussing with you the nurse's role in the surgical count process. The Royal Children's Hospital defines a surgical count as the process of counting any item that has the potential to be retained in a patient during a surgical procedure. As a nurse, the responsibility lies in initiating the surgical count. The fundamental purpose of the nurse is to ensure that all instruments and items used during the surgical procedure are retrieved, accounted for, and documented correctly. Adele 2012 discusses the importance of adhering to count practices and guidelines in order to reduce the risk of a retained surgical item. Different hospitals have different policies, however they all cover the same principles. The ACORN Standards of 2011 state that a surgical count must be performed by two nurses, one being a circulating nurse and the other an instrument nurse. The New South Wales Government 2013 surgical policies outline that the nurses initiating the count must count out loud and simultaneously whilst clearly visualising all of the items involved in the procedure. The policies also outline that a minimum of 2 counts are required, one prior to the surgery and one post-surgery. Additional counts may also be included when additional items are added, at the discretion of the nurse conducting the count, if an interruption occurs, or any closure of a body cavity. The Association of Surgical Technologists 2006 discussed the surgical counting procedure. They discuss items such as sponges, sharps, instruments, and miscellaneous items. They discuss that sponges are counted first, followed by sharps, followed by instruments. A video by registered nurse Karen Sheehan clearly outlines that the counting procedure should be systematic and that documenting should be conducted accurately. She also outlines that the inspection of all items is required following the count to ensure cleanliness and functionality, and that any items not meeting criteria should be disposed of and documented. Norton 2012 acknowledges that items utilised should be radio-opaque. This enables the items to be located by radiography during the surgical procedure, thus decreasing the possibility of an RSI as they are clearly visible to the surgeon and nurse. The nurse also acquires the role of ensuring the environment for counting is suitable. Spruce 2016 outlines that the nurses should minimise noise, distractions and any interruptions during the process, and that they should implement a non-interruption count zone. The nurse should also be aware of possible risk factors that can cause potential for an RSI occurrence. This can include emergency procedures, extended length of procedural time, an unexpected change in the scope of the procedure, and morbidly obese patients involved. Ultimately, counting is fundamental for patient safety, where documentation is vital. The nurse evidently acquires high responsibility in the surgical count and must follow specific policies in order to achieve optimal patient outcomes. Thank you for listening.